It's 5:30 p.m. on Monday, November 28th, and I'd like to call this work session to order. Just so that way everyone in the audience and those watching at home know, this work session is going to be a little bit different today, in part because we have to adjourn to executive session before we move on to regular meeting. We still plan to start the regular meeting around 7 p.m., but I wanted to give everyone a heads up that we will adjourn for that executive session in there, have our executive session, and then come back out for our regular meeting at 7. Our first update is city updates. So Ms. Solano, please take it away.
Thank you, Madam Chair, councilors, and Mayor Gradisar. I have 3 very quick city updates this evening. The first is a COVID update this afternoon from the Colorado Department of Public Health and Environment. The last 7 days of positive case counts in Pueblo is 247 with an 11.2 positivity rate and 9 days of stabilized COVID patients at Parkview Hospital. And then moving on, I wanted to just update that earlier today, the mayor did sign the declaration of temporary housing and shelter emergency beginning at 5 o'clock tomorrow evening, Tuesday, November 29th, and ending on Thursday morning, December the 1st, as the weather is predicted to have low temperatures and perhaps some snow coming in. So that is in place, and the Crazy Faith Ministries has been informed and are working on their plans. And the last update is Councilor Winter had requested a week ago an update on the ARPA trash removal numbers and progress to date. And the trash removal coordinator full-time position closed the 17th last week. There were 13 applicants and 7 of them were approved with qualifying for the position. The exam is scheduled for tomorrow, and after the exam results, it'll move forward into interview and then to civil service for approving any list of those that passed the exam. You also asked about the temporary the applications for the temporary trash removal workers, and there are 4 to date, which is an increase from 1 from last week. There were just 3. So we're working with civil service on where to announce the vacancies in different locations with maybe posters and things that we can post throughout the city in potential for interested individuals like the transit system stations and in the buses. So they're working on maybe some increased marketing spaces for the part-time employees. Also did receive a message from the Director of Parks and Recreation that I think last week they ordered all of the bags, gloves, trash grabbers, and the all the supplies that they need. They actually purchased one of the trucks that they'll be needing and working on getting the other one ordered this week. So that was the update I think you asked last week. And that concludes the updates. If you have direction for me.
Thank you, Ms. Solano. Councilor Winter.
Yeah, I just had a question. So we're looking for 21 people to pick up, correct? And we had 4 applicants?
We have 4 applicants, so we'll have to move on working with the Director of Finance to issue the RFP. And so we can find the payroll provider and then actually secure part-time applications from individuals that are experiencing homelessness if interested, so training can begin. But this part-time announcement did not go out to that population yet.
Okay. Do you know what the stall is on that or why it hasn't gone out yet?
The RFP?
Right.
No, we will begin working on that now. I think the delay was we thought we would secure more part-time applications from interested individuals in the QCTs. So we feel like it's a different kind of marketing that we need to.
Well, definitely, because don't these folks, they have to qualify. So say if they have any kind of housing assistance or something, they have to be really careful with how much money they're making, correct?
They have to just live within a QCT. So then there's the additional qualifying factors.
Right, which can mess with a lot of other programs that they might be on. So I'm just wondering if we need to go in a different direction there.
We certainly will be back if we don't. I don't see Stephen in the room, but we'll see what happens with our RFP and the plan to advertise for day labor rates. As soon as all the materials do come in and the truck is in place, he'd like to get out there and begin work.
Right. But when you're looking at folks that are on housing programs or any kind of food stamps, that kind of thing, they're not really your transient bus people, advertising people either. So I think we might need a different direction here soon because we need to get on the ball quickly.
Thank
So
you.
how much time are we looking for the full-time person? How much more time?
I would suspect we'd have someone hired and through the background check before the end of the year. So throughout December. If the exam
So-
is
And we
tomorrow,
started this process when?
the announcement went out it was open 21 days and closed on the 17th. So the last of October,
So it's going to take what, like 2.5 months?
2.5 months.
Okay, thanks.
Other questions or comments from council? Counselor Graham?
We have an update on the small business letters. I know I keep just getting the same answer.
Thank you for the reminder. And I do have it and I'll send it tomorrow.
Other questions or comments? Similar to Counselor Winter's comment, I am planning and I hope that I can book it on the schedule to have actually quarterly updates from the $1 million ARPA pot of money for the cleanup. So that way we can hear the progress on that throughout the year. So I would like to start having quarterly updates in 2023 about that. So we'll get that on the schedule, and that those can be as small as we have this trash coordinator to our next cleanup is Counselor Winter.
Yeah, I just want to stay on top of it because to me, this is just Groundhog Day over and over and over. So this is kind of the same scenario we have all the time when it comes to picking up trash. We go to neighborhood spots and sometimes we've had the fire department come out and clean up and the dumpsters are full within 10 minutes. And then it's ignored. I mean, it barely puts a dent in it and then it's ignored, but it's kind of the same process that we're seeing now that we've been through over and over. So I don't think we should be waiting too long.
Perhaps then what we could do is have an update January and then our next one, March, then the one after that, July, the one after that, September, the one after that, December, just to stay on top of that. But I did have that written down actually that I was going to schedule that.
Yeah, maybe monthly, because if it just keeps going like this, we probably want to look at contracting.
Other questions or comment? Counselor Atenzio.
Yeah, will this body consider a mandatory trash ordinance for all property owners in the city of Pueblo? That'll help a lot. It'll probably save us $1 million. But nobody here wants to do that.
Counselor Winter.
Larry, as you know, we brought that forward before, and it was shot down by legal. But then you and I also talked about mandatory trash for the owner of the property. So that way, if you have tenants, et cetera, that tenant has trash paid for. So I would definitely support an ordinance like that.
There are other cities in Colorado that have mandatory trash.
Yeah, it's just a matter of getting through our legal department.
You want to clean up the city, that's a good way.
Well, then we can bring it forward if we can get it through legal.
Perhaps we have a work session about it.
We've had work sessions before about it.
But
So let's just get an ordinance and then have a work session.
yeah, not with this new Counselor Winter. So I would appreciate a work session about it come, in the next several weeks about it. And then we can move forward from there. Other questions or comments from council? Great. Moving right along is the mobile crisis unit. So can I have Miss Miller to the podium, please? She's going to be presenting about a very similar idea to the 211 update that was talked about at the last regular meeting in response to people experiencing crises mental health, behavioral health, or those experiencing homelessness. So Miss Miller, take it away. And can I have the guest say their name for the record?
Good evening. I'm Heather Hankins. I'm the Chief Operating Officer and Chief Clinical Officer for Health Solutions. Glad to be here tonight.
Okay, we have the slides I mentioned. There they are. So this first slide is representing our traditional crisis response model that most people are probably aware of. Oh, the slides are down here too. Lovely. So typically a person may enter into a crisis system by calling 911 and get EMS or police as their first point of contact. And then through that process could have the different measures of response depending on the circumstance. So there's typically a long wait time through an emergency department. And again, another long wait time for possible referrals to some type of treatment option, or they will sometimes even go the track of getting legal charges and end up in our jails and clogging up our jail system. So recently SAMHSA put out a new model, if you want to click the slide. This is the federal guidelines for a crisis mobile response. And I should clarify, it's just not just mobile response, it's the entire crisis continuum and how we can respond as a community to a crisis in our various communities. In July 2022, the state law or federal law passed the 988 crisis line number. So that's that first phase, that warm line phase. And then it gets into possible different response options for whatever the behavioral health crisis might be. And the great thing about our community is we actually have most of the stuff that's already represented in this federal recommendation. When they made these recommendations, Colorado was already advanced enough that they already had a crisis line number. So it was really easy to incorporate the 988 three-digit call number in our existing call process system within our state. Not all states had that advantage. If you click the slide, I'll start talking about, I'm going to try to make a presentation of how a person may go throughout the entire crisis continuum and how our community responds on all levels of that crisis continuum. So our first step that a person typically would enter into a crisis setting in the new model would be that warm line. They can call 988 and they will get routed to this Colorado crisis line number, but the Colorado crisis line number has existed in this state since 2014. So it's just a longer number that's harder to remember, right? 988 is much easier for people to remember. But if they call the 800 number for a crisis call, it'll get routed to the exact same space as the 988 number. The challenge that 988 does pose currently, and we are still trying to solve, is there's not a real way to do geolocation. So if you call 988 right now from Pueblo County, but your area code is not 719, you'll get routed to a different state's call center. But if it's an area code within the state of Colorado, you will get routed to the Colorado crisis line number. And that number is answered by a crisis clinician. So they call that a warm line. They try to avoid the crisis there. So if they can address the crisis by phone and triage the situation, they will do so on that line. If they need somebody to be in person for that crisis response, they will send out local mobile crisis teams, and Health Solutions is the person that they will deploy. So they do what's called a warm handoff to a local team, and they will call our line and ask us to deploy to that location, to that person in crisis. They'll give us the circumstance and situation of the person in crisis. And then they will do a follow-up call to that person within 24 hours of their initial contact. You'll see that throughout the presentation. At every level of crisis intervention, there is always an element of follow-up to see if they got the services that they needed. So I put the link to the Colorado Crisis Service websites because I still am, kind of pushing people to that number because of that geolocation challenge. That I don't want someone to call the 988 number and get routed to another state. So, but if they do get routed to another state, they can redirect them. It's just, we don't want to make it hard for somebody when they're in crisis. We want to make it simple. So, and there is no wrong reason to call. If you go to that website, it's very clear there's no wrong reason to call that number. So next slide. So then the next response option is this mobile crisis response. And that's what you guys are speaking to, this mobile crisis unit. They will respond with a crisis clinician, a trained licensed clinician, and a peer support specialist. They will respond to that call within an hour. That's our maximum time, but we can get there typically faster than that. When the team arrives, they will do this 20-point crisis intervention assessment that's required to the state and attempt to stabilize the situation and the least restrictive treatment options. So if we can stabilize them in the community, we attempt to do so. We will utilize resources that they have around them, whatever family, friends, or community members that are part of their community, we will utilize them to help stabilize them. If they need further treatment than what we can divert from, we will make those connections. We will make sure insurance pays for those treatment providers, and we will transport them to those treatment locations. And we will also do a 24-hour follow-up after our mobile crisis response to that person. Next slide. So another potential option that a person can utilize is our crisis living room. So if we're not going mobily out to that person, they can also come to us. We have a 24/7 crisis living room that's staffed by the same type of staffing or similar staffing, I should say, a crisis clinician, a peer support specialist, but we also have an EMT on site. They can go there for what we call a self-defined crisis. They define that they're in crisis. They can present there in person. Someone who calls that crisis line, that 988 number, may also be encouraged to utilize the crisis living room. It depends on the crisis situation when they take the call. We do a similar crisis stabilization process that we would do mobily. We add an additional triage. So we do that triage that the phone call line would normally do. We would do that triage when they walk in, but otherwise we do that same 20-point assessment. And we make those same recommendations of treatment and care that we would if we were going mobily. Go ahead and go next slide. So those are the different ways we could respond in a crisis. These next slides are going to represent the different type of treatment options we have for an individual in our county. We have the option to provide a respite stay. It's up to 14 days. That is an alternative living situation. If their current situation, living situation, whatever that might be, is contributing to their crisis, then we can place them in our respite unit for up to 14 days. That respite is meant to have intensive wraparound case management support to get them engaged in treatment to hopefully divert for future crises. Because if we can intervene early, then they won't be in crisis later on. It is also used for people who are in transition. If they are going from a higher level of crisis down back into the community, we will sometimes use respite for that as well. Go ahead, next slide. Our next option, this is locally in our community in a service at Health Solutions. We have a 15-bed secure inpatient facility, psychiatric facility. It's for people who are 18 years of age or older in an emotional crisis. The purpose of our acute treatment unit is to provide a less restrictive alternative to, say, an inpatient hospitalization stay. We can accept people in treatment who are both voluntary or involuntary. We typically are serving individuals that have suicidal thoughts, need for medication adjustments, suffering through grief or loss or psychological pain. This is useful for a person that couldn't stabilize at a less restrictive setting. We may need to go and admit them to our ATU. And again, we provide follow-up in this level of care as well. So when a person discharges from the ATU, we will do a 24-hour follow-up upon their discharge. We will also ensure they have an outpatient appointment with any provider of their choice within 7 days of discharge from the ATU. Go ahead and next slide. Transportation is important because we are required through our state regulations to provide transportation across the entire crisis episode. So if a person that we see in a mobile crisis needs to go to our ATU or a crisis living room or our respite center, we will provide that transportation. But also if a person needs treatment outside of our city and they need a higher level of inpatient care than we can provide within our city, we will provide transportation for that individual as well. So we will get them to that treatment center. We will also follow their care during their hospitalization stay. We usually try to do 3 contacts a week during their stay in hospitalization. We want to get them connected back to community resources as quickly as possible so that when they discharge, they have connection to some community supports. Transportation is challenging for us, as you can imagine, because it's if someone needs an inpatient hospitalization that doesn't exist in our 3 counties, we cover Pueblo County, Huerfano County, and Los Animas County. So aside from our 15-bed ATU, the closest inpatient treatment is going to be Colorado Springs. So we would provide that transportation even from Los Animas County up to Los Animas County. Starting July 2023, the state is willing to reimburse and pay for transportation. They have not paid for it up to this point. But in order for the company to get reimbursed for that transportation, they would have to be licensed and monitored by the county commissioners, local county commissioners. And as far as I know, there is no secure transport companies in our 3 counties that is licensed by the county commissioners for secure transport. So we have to use private companies that can't get reimbursed. So we pay them out of our funds for that transportation. So next slide. This is just a final slide on our, what we call them caring contacts. These are our follow-ups. Again, along the entire crisis continuum, if someone's in crisis, we provide that follow-up care. And when they are discharged from any of those levels of care, we will continue to provide follow-up. We don't close that crisis episode until we go 45 days with no contact. So if we go 45 days with no contact, then we close that crisis episode and we consider the crisis closed. But they're always welcome to return to our services at any given time. If the person is discharging from that inpatient facility that I spoke of, we will also make sure they get an outpatient appointment within 7 days. That's not just the ATU, it's also from a private hospital. If you want to click the next slides, these are just some pictures. I included these so you can get a sense of our like brick and mortar of our crisis response unit. So these are some of our, this is some of the pictures of some of our programs that we offer. This is the acute treatment unit. And then if you click the slide again, those are some slides of our crisis living room. So our crisis living room is open 24/7 to this community as well. And so I wanted to include those because I think it gives a good representation of it not being a clinical hospital setting. We really do want to recognize that somebody in a behavioral health crisis may not be somebody that needs an emergency room. They could potentially benefit from our crisis living room, where we can provide essentially the exact same care they would get in the emergency room, but in this setting, so we can avoid them going to an emergency room. So that's the end of my slides. If you have specific questions or.
Yeah, thank you so much, Ms. Miller. What questions are there from council? Counselor Graham.
Can you tell us how many calls on average you get?
So I didn't think to bring that data, and I probably should have. We do track it. And I mean, I would be guessing if I threw out a number, but we're talking probably hundreds of calls, in the hundreds. It's not a small number. If we count our walk-ins as well, that could change. And then many of our calls we can manage by phone without mobile response. So our mobile numbers are probably closer to like the 60 range, but I don't want to give you false information. I can get you that number if you're interested.
And then how full is your 15-bed capacity right now?
How full is it right now? Oh, I didn't look at the census.
It was about 10 to 11 this weekend.
We probably run around 10 to 11. That's not unusual. So we typically have room. Our respite tends to fill up faster, but even that was probably what, around 6? Oh, was that 4? Yeah.
And then my last question is, when you're going on this mobile crisis calls, how often do you have to call Pueblo PD to go with you?
So we track that data too. I could get you that data specifically. I recently presented it to the board. It's smaller than you may think, but I don't have the numbers exactly. I can get you all that data though. We track it.
Yeah, I know you guys are here because of the sit-lie ordinance from a few weeks back and how you guys actually do provide services that businesses or anybody could call if they're having a problem with a homeless person in crisis. And so I was curious why we've never known about this kind of.
So we can
until
help
now.
anybody in crisis. I just want to clarify, like your family members could call,
Sure.
anybody could call us.
Sure.
And I'm actually excited to have the opportunity to share this for that very reason. I think we're underutilized
Sure.
for the options that we do have in this community.
So if you could, get back to me on the number of calls you take per month. And then how many times you guys have to call PD to go with you. Thank you.
And we do track that monthly, like I said.
One piece that we didn't include in this continuum is one piece that we didn't include in this program is our CIT program, which is our co-responder program, where we actually have clinicians embedded with PD. And we do have some really great outcomes since we've started that program. And with ARPA funds, we were able to almost double the number of clinicians we've embedded with PD. So reducing the amount of time that they spend on calls with behavioral health or mental health issues, reducing recidivism and reducing folks going to jail if it's mental health related. So we can certainly get you all of those numbers.
Other questions or comments, Counselor Flores?
Yes, I'd be interested, since you're going to be sending us some information as to, our police department is overwhelmed many days with taking some calls that probably shouldn't be going to them. Are there any national statistics or local statistics about how much time you do or how many calls you take or percentage of calls the police department are reduced by your intervention? Is there anything like that?
I could get that from the state. What's interesting is this morning I was at a community response with some other members within the community up in El Paso County. And so I was talking to the state representation for our 988 implementation within the state. And so she knew I was coming here today. So she told me if you guys wanted any type of data from the national level, because 988 is national, she can get you that information. So I can get some of that information that you're looking for.
The first thing that comes to mind is that it's being underutilized, and I think you've confirmed that. But I think the big part, and I think President Graham touched on it, and that is that a lot of people don't know it's out there, and it's going to be very beneficial for us as a city to make sure that everybody knows that that's available. And it just seems like it's a well-kept secret, which is not intended that way, but it certainly feels like it's underutilized, and we should try to help market it at least.
I say this a lot. I think every person in this town needs the number on the refrigerator. You never know when somebody that you love is in crisis. So yes, I agree. I think the number should be out there to everybody.
Thank you.
Counselor Maestri.
Well, do you have any sort of outreach yourself? I mean, do you have somebody that goes out into the encampments and along, in the areas where the homeless people are hanging out and hand out your cards or speak to them? Or are you like getting together with that community and letting them know that you have services?
Yes, they are aware of our services. My understanding is they have our numbers that they hand out to individuals when they do outreach. I didn't even bring this team up in our conversation because it can get confusing with our mobile team, but we do have what's called a mobile early intervention team. And they do more of that outreach that you're speaking of, where they can go outreach with different individuals. But because it has mobile in their name, it gets confused with our mobile crisis unit. So I deliberately kept it off of this presentation because I don't want them, because they're not 24/7. They're not a crisis. All of our crisis services across the entire continuum are available 24/7. But the outreach teams, they typically may go like the next day. If they get called today, they'll put it on their outreach list for tomorrow. And they go anywhere that there's a request for outreach, including down into the encampments. And they do work with other local providers that do specific outreach in this community.
Thank you.
Counselor Winter.
So everyone, it sounds to me like what we were asking about is the services that are already in place, because it sounds like we have outreach that do go to with the police. So it sounds like that's already in place. So I don't think if you have somebody passed out in front of your storefront, they can't call that number. Somebody would call the police and they would have a social worker with them anyway. So exactly. So yeah, so it sounds like it's already covered.
I guess my question then is to President Graham, she owns multiple storefronts and also other business owners, because we do have an issue sometimes with violent homelessness. So if I see one of those individuals, I can call this number and then have a mobile crisis team dispatched to that location within an hour, 365, 7 days a week, 24 hours, 365.
Correct.
My question then is also, that's fantastic. Thank you, Ms. Miller. So if someone calls 911 to report on someone who's experiencing homelessness or someone who's defecating on the side of the street, is there a way that we can merge the systems where that 911 dispatcher gets in contact with the Health Solutions Mobile Crisis Unit to then dispatch instead of then calling 988 or whatever that looks like? Can we merge the system so local 911 dispatch can get in contact with your guys' team?
So I think with local 911, at least with local 911, at least with the public police department, I think they do try to dispatch whatever PD has a clinician in the car with them at that time. So I think you're right. I think trying to merge those two, and it is at federal and state levels where there have been some communities that have been able to implement that, where 911 will dispatch maybe just this crisis team. And so we've really been encouraged to use the 988, and they'll try to do some triage there. And so I think a couple things that I'd like to bring up is one, that not all of those situations would would probably come to us that would be appropriate, depending on, how violent they are, we're clinicians, we're not armed, things like that. So there is a piece that has to be navigated in some type of triage type way. And the other piece is, funding. Our crisis system has always operated in a negative of millions of dollars.
Yeah.
And so when we're spreading the word and trying to get more and more folks out, a couple pieces we have is funding and then workforce shortage. And we're really trying to work with the state and federal to try to get more funding to help support these pieces that we need in our community. And then in addition to that, workforce shortage. So we're, as a organization, we're really trying to do a lot of things to help support the workforce. Our childcare center is getting ready to open any day now, internship programs, tuition reimbursement, so that we can have more folks coming to work for us. Since COVID, a lot of people can work remotely. And so it's kind of hard to compete with that. You can work remotely at home or, come in and work in the cold and go to the river bottom. So it's hard to compete with that, but we're doing our best to be great employers and really attract the best.
Other questions or comments? Counselor Maishy?
It is kind of a little bit to put on the public to make that determination too of, someone breaking someone's windows out doesn't necessarily mean that they're mentally ill. They could just be lawbreakers. And so I think that when you're trying to not perfect, but perfect the system, that you need to take that into consideration too.
Thank you for that. I do appreciate that comment because you're right. We do have folks that have severe and persistent mental illness that don't understand that, defecating in front of somebody's home is wrong. They're kind of in their own psychosis possibly or confusion. And then there's those that are just lawbreakers. And so when we do respond, we are really responding to that person and how can we help them? How can we get them the resources, the support that they need to help them live a successful, fulfilled life in a good part of society?
And how many children or adolescents do you come across in your crisis?
I have that data too,
situations?
just not in front of me. We keep all that data. We report it on a monthly basis, so I can get as much data as you guys are interested in on our crisis response, including the age, and we keep a lot of the various demographic information.
To give you an idea, am I still on?
Yeah.
To give you an idea of large picture, Health Solutions serves about 13,000 individuals on an annual basis, and we serve about 750 individuals daily. And that's adult, children, families.
Is that over 3 counties or just Pueblo
Over
County?
3 counties. Of course,
Okay.
Pueblo is the majority of that.
And then also, these are public meetings. So we have them for the public. So you sending it to us isn't fair to those that are also listening. So it'd be nice to, anticipate what types of questions we're going to have in the future because I'm sure everybody in the audience would like to know. Thank you.
Counselor Tencio?
Talking about 911 calls, are you or have you worked with the dispatchers at 911 to train them as to when to hand off a call, not to a police officer, but to a mental health worker?
Mental health first aid.
Yeah, we do help provide with the CIT trainings. We help support that. We don't provide the training ourselves for the local team. And then mental health first aid, those are trainings that are offered to the officers. But I think, I forgot who said it earlier, trying to determine when 911 versus 988. I don't think we've really helped
Yeah, that's
define
what
the
I mean.
difference between the two
Yeah.
calls. Yeah.
If the 911 dispatcher were
Mhm.
trained
We
a
do
little bit
have,
more, maybe they would be able to divert
the
the calls
CIT,
where
yeah.
they need to go.
I think with the CIT program, we have a case manager who's right there with the 911 dispatcher so that they can be part of, if it's a frequent caller.
Mm.
I think that there's 2 different case managers. So we have 2 case managers there with the 911 dispatcher embedded in the police department.
Just as
And
good.
then, I don't know enough to speak to.
Just thinking.
So So it sounds like you'll send us some data. I think that this is a really needed in our community because mental health crises are experienced by everyone at every age, but particularly those who may be experiencing homelessness or who may be, also co-recurrent of committing crimes. So I would like for you all to think of like if the city can help at all, whether that be merging the dispatch systems or however that may be, please let us know. And in the meantime, we will start referring people then to calling 988. If they don't have an area code that starts with 719 or 303 or whatever, what number should they call?
So they can always call the Colorado Crisis Line number, and I put that website in the slides. And they can still use 988. There's no wrong door. Wherever they call, we will find a way. They can call us directly. Many people actually call our office line directly, and we can go mobile for a direct call too. However they reach us, we'll take the call. I think it's unfortunate that it's not as smooth as it could be, because when someone's in crisis, it should be a smoother process. But yeah, you can give either the 988 number or the Colorado Crisis Line number. Either will get them to the exact same spot.
Thank
Just making it
you.
harder for others.
Yep. We will start then referring people to 988. Thank you so much for then sharing the data. Thank you, Health Solutions, for that really valuable presentation. Moving along then is our redistricting update. So Ms. Stoller, you're up.
Probably the only one who would get it, so since you're the only one that sees it. So as you, let's see here. Waiting them to get up the document displayer here so I can point to things, which I can't do on the big screen. So Chair Martinez, members of City Council, Mayor Gradisar. As you may already know, the city charter requires that the city of Pueblo undergo redistricting every 4 years to ensure a fairly even number of voters live in each district. Our last redistricting cycle was in 2021. However, at that time, we did not have the US Census data. The delay that was caused by that because of COVID did not give us updated numbers to redistrict with. So in 2021, the numbers just stayed exactly the same as what we had it. The election board voted to keep those districts until we did have that additional population data. So we do have that data now. And our GIS team has worked to provide a few options for us of the fewest number of districts to swap to minimize confusion that still brought the populations of the 4 districts back into balance. So based on the new population information, the ideal population for each district is 27,963. So if I don't know how well we can see this, I think there's a zoom in option maybe. Maybe not.
Would it be possible to have that whatever showing on that on here? On the projector?
There should be tabs that
Oh.
you have on there. So you should be able to tab over to it, I believe. Any luck?
Councilman Flores did remind us that we all have copies.
Yes, council does have maps and hopefully I've zoomed in on this now so the public can see as well. So the ideal population you can see is right here. And then this is the current makeup of the districts. So you can see districts 3 and districts 4 are already very close to this number with standard deviations of just negative 0.1% and negative 1.3%. So ideally, we would want to keep that standard deviation under 2% when we're balancing the districts. And both these districts already sit at that level. So the GIS team determined to leave those 2 districts as is in their proposed maps. Districts 1 and 2, however, you can see are 6 and negative 4.6% deviation respectively. Both are over that 2% desired rate. So to fix this, the GIS team did come up with 2 separate proposals. So the first proposal is called Proposal 1. I know we're very original. And this proposal basically just moves one precinct, precinct 9, from District 1 to District 2. So you can see here, right here is 9, and all they're doing is moving it from 1 to 2. And what this does for the numbers down here is essentially changes the standard deviation to get it under 2% for both of those. So District 1, the deviation is 1.8%, and for District 2, it would be negative 0.4%. And then the second proposal is a little more complicated in that it would move precinct 6 from District 2 to District 1 and precinct 10 from District 1 to District 2. So you can see precinct 6 is right here and 10 right here. And so it would basically swap those two because the population of 6 is much smaller than 10, but it would kind of even it out. And you could see that this gets you an even lower standard deviation for both of those districts 1 and 2 of a 1.3 for District 1 and 0.1 for District 2. So those are the two that were recommended by the GIS team. While the second proposal does lower the standard deviations, staff does recommend Proposal 1 for approval by the election board because it only moves one precinct. And so that just caused less confusion for the city's constituents. The election board did hold a public meeting presenting both of these options to the public on November 15th. And a few questions from the public were answered at that point. There wasn't any further discussion from the public netted. Our office, the city clerk's office, will continue to take written public comment until noon tomorrow. That can be dropped off in person at the that's downstairs in City Hall, first floor, or it can be emailed to clerk@pueblo.us. The election board will meet this Wednesday at 2 p.m. to discuss this decision. And one thing that I'd like to note is that originally we believed that the election board's decision was something that would have to be ratified by city council. But after additional research, we no longer believe that that is the case. So this will not be brought before council following the election board's decision. So I particularly wanted to make sure that we had this discussion tonight so that council could weigh in any way that they would like to. I am available for questions.
Thanks, Ms. Stoller. What questions are there from council? Councilor Maestri.
One thing I'm really concerned about is that when elections come, that this is straightened out and not like our previous primaries were, where they had redistricted and they didn't have the proper House districts. So that's what I'm going to keep an eye on.
Are you talking about for the ballots being sent out?
Correct, for the elections department for the ballots.
Yeah.
So when we
unfortunately-
go to print ballots on the next election, I want to make sure that we are redistricting it, that you guys are watching to make sure.
Yeah, unfortunately, the county is the one that does print and run those elections. for us
Correct.
In the city.
But we also have to have someone watch for that. So,
We do get to look at the standard ballot, but we don't look because there's maybe 14 or 15 different ballots that go out within the city, depending on where people live and depending on what topics they vote on.
mhm.
And so we don't unfortunately see all of those different versions. And that was where the problem has lied in the past.
Well, we know where the changes are being made and maybe we can look at the ballots in those areas.
That's true.
Thank you.
Thank you.
Other questions or comments?
So proposal,
Councilor Tencio.
proposal 1 is your preferred.
Is staff's recommendation.
All right, seeing no other questions or comments, thank you, Ms. Stoller, for the update. I expect that we'll hear about the election board's decision later this week or,
Yes, a memo will go out to council.
okay, thank you, Ms. Stoller. All right, so now I will take a motion to adjourn into executive session.
I move to go into executive session for a conference with the city attorney for the purpose of receiving legal advice on specific legal questions under CRS section 24-6-402 paren 4 paren B, and for the purpose of determining positions relative to matters that may be subject to negotiations, developing strategy for negotiations, and or instructing negotiators under CRS section 24-6-402 paren 4 paren E. And the following additional details are provided for identification purposes. First, to instruct negotiators regarding economic development projects and issues presented by the Pueblo Economic Development Corporation, acting as agent for the city of Pueblo. And second, to receive legal advice from the city attorney regarding A, municipal regulation on abortion clinics, and B, proposed amendment to the city charter. Second.
I have a motion and I have a second. Councilman Flores. All right, so now we adjourn, or do we have a vote?
We'll go ahead and.
Counselor Martinez, I'd like to ask, why are we, if we have a, one of these subjects on the agenda, why are we going into executive session?
Mayor?
I think so that the city attorney can give you legal advice.
Is the city attorney here this evening?
It will be for that portion of this agenda, yes.
But why would we have to have that in executive session? It's on the agenda, so the public should at that point hear what the legal advice is on it. It's not mandatory, right? Because I went through section 24-6-4024, and I didn't find anything that made this particular ordinance need to be in executive session. Can you, can I have the statute on as to why that we would take this particular ordinance into executive session?
It's not discussion of the ordinance itself. It's discussion, it's legal advice from your attorney. You're getting legal advice from your attorney.
Well-
Typically, that's confidential privileged information, which you
Well,
want to
if
keep.
he's representing the city, the taxpayers of the city, well,
A lot of the time, there are sensitive legal matters and you don't want to give away the way that you are going to be leaning one way or the other when you're discussing your legal options.
Regardless, we do have PEDCO on the agenda as well, an executive session.
Mhm.
Councilwoman Winter.
Yeah, one thing to remember too is that you're supposed to report back after executive session, which is something we've never done. I know that a lot of times executive session is at the end, but really legally that tape should keep rolling and then you come back and report back after executive session. So that is something we should be doing this evening, especially.
I believe that's only the case if the meeting continues after the fact. So if you were to be taking an executive session that was not a planned executive session, and where you were talking about a subject and then you took an executive session to get advice from your attorney, then you would come back and discuss at that point.
In a public meeting, you always have to report back after executive session.
believe
Always
that's-
Colorado law.
I don't believe that's the case.
So there's a motion and a second on the table. All in favor kind of a thing?
That's normally what we do.
Okay, all in favor?
Aye.
All opposed?
nay.
Then there's one nay.
Okay.
There's one nay, 6 yays.
Yes.
We adjourn into executive session.